Hello, everyone. I'm Renee Haney, East Coast Metro Chapter Director. We are so proud to bring you to the Zero Prostate Cancer Run Walk celebration. We're coming to you virtually from New York City and Rockland County. But before we begin, it's important that we acknowledge all of the country and New York City in particular. They have all been through a lot this year. As you know all too well, New York City was the first epicenter of the COVID-19 pandemic. We will not forget the silent streets after the first stay-at-home orders, or the closures of iconic businesses and landmarks. And we will certainly not forget the thousands who have lost their lives because of COVID-19. Today's Run Walk is virtual because of this pandemic. While we want to celebrate Zero's amazing fundraisers, supporters, and prostate cancer survivors, we also want to keep you safe. For Zero, this city is a shining example of how together we can do anything. We are New York tough and we are Zero strong.
Patients, caregivers, families, and fundraisers have come together for one common purpose: to stand with the brave men battling prostate cancer during these unprecedented times. Together, we are survivors. Together, we support prostate cancer patients during COVID-19, and together, we are Zero strong. Please join us for the Zero Prostate Cancer Run Walk celebration, coming to you virtually from New York.
Hi everyone, I'm Renee Haney, and I am so excited to kick off the New York Prostate Cancer virtual celebration. I'm here in New York City, and as you can see, there are no crowds of runners anywhere around me this year. Instead, you're all out there running and walking virtually, and trust me, our hearts are truly warmed by all of your support this year.
Hi everyone, I'm Zero Champion Athena, and I'm absolutely thrilled to be co-hosting this year's walk with Renee.
First up, we have to thank our host partners, the New York Section AUA, Hackensack Meridian Health, Montefiore, Weill Cornell Medicine, New York Presbyterian, Columbia Doctors, Mount Sinai, Northwell Health, and the Ripple Runners. Coming up, we're doing things in true New York style by introducing you to an off-Broadway actor named Patrick Bowl. Patrick is our mission speaker, and he's talking about what it's like to share his prostate cancer journey in a most unconventional way, a cabaret act. Plus, we're taking you on a road trip to Rockland County. That's where Zero's CEO, Jamie Burse, is meeting up with Nancy Diamond and Sue Spector for the Andrew Zweig Ripple Run and our Bold for Blue Spotlight. And of course, you don't want to miss our prostate cancer survivor ceremony.
But before we get to all of that, here's a word from our premier partner, APPV.
We're so excited to be here to represent APPV. All of us at APPV realize it is such a great honor to be a premier partner of the Zero Prostate Cancer Run Walk series.
It is truly important to us to be part of this series to help men battling prostate cancer and fight for an end to this disease.
We're here to support the patients, survivors, caregivers, friends and family members here today and across the series.
Special thanks to the New York City hosting practice and the Ripple Runners of Rockland County for dedicating their time and effort to help prostate cancer patients as well. Together, we are Zero strong.
My name is Patrick Bowl, and greetings from New York City. I am thrilled and honored to be this year's mission speaker for the Zero Prostate Cancer 2020 virtual Run Walk celebration. My journey with prostate cancer began in the summer of 2016. I was 53 years old. I went and had a physical. My doctor said I had a PSA of 1.13. I said, "What's a PSA?" And he explained that it was a prostate-specific antigen test, and it was sort of a marker of how likelihood I might be to get prostate cancer. I brushed it aside, thought nothing of it. A year later, I had another physical, and my doctor said my PSA was now 2.85. He said it was well below the threshold of 4, where things start to look more serious, but the fact that it had doubled, more than doubled in 1 year, was a concern to him. So I took that in stride. I failed to mention earlier, I'm a professional actor. I was about to go on the road. So when he said you should go see a urologist, I thought to myself, well, I feel perfectly fine. Why would I need to go see another doctor? I'm about to go on the road. Everything's going to be good. Wrong decision number 1, although everything turned out fine. But I went on the road for about 6 months, came back, and thank God my wife said to me, you know, you really should go see that urologist. Turns out I was diagnosed with cancer. I found out on the day of my 55th birthday. Happy birthday to me. I had my surgery November 1st, 2018, and knock on wood, I don't know if you can see the wood railing that I'm knocking on, but knock on wood, my surgery was successful, and I've been cancer-free since then. I was very fortunate within a month or 2 after I was diagnosed to attend the New York Prostate Cancer Summit. And during the course of this morning, I came across Zero. And to be honest, Zero was the one group that really stuck out to me from this seminar because they offered a lot of great information, a lot of awareness, and there was a lot of positive energy and a lot of hope about living with prostate cancer, which is something that I always told my children in the beginning. I said, look, I'm not dying from it, I'm just learning to live with it. And we're gonna learn to live with it as a family. Last year, 2019, when the run came around, I was thrilled that I could actually be a part of it. And, you know, it's a really, really wonderful experience. One of the things that I did for myself and for others, I thought, well, how can I share the gifts that I have and share it with other people? About a year ago, I did a cabaret act called These Guys Are Trouble. And one of the numbers I sang was a little song about surviving prostate cancer. But I do a part of the show where I talk very seriously and very pointedly to any men, any women who love men, any men who love men, anyone. Please get your PSA checked. PSA is such a simple thing. It's a simple blood test. It's like having your cholesterol checked. It's nothing more, nothing less. They don't have to do anything big, but it can save your life because it saved mine. And I can say that without hesitation. The best thing you can do for yourself is to take care of yourself. So please, eat right, exercise, whatever that means to you. Like I say, walking, gardening, doing sit-ups, anything. And hopefully we'll see you out here next year in New York City at the 2021 Zero, the End of Prostate Cancer Run Walk Celebration.
You know, one of the biggest moments in Superman is when, we say that you're not alone. We never want any of our survivors at Zero to ever feel alone because they're not. We're all here for you. Reach out to a champion. Reach out to us on Facebook. The support group, Zero Connect, is there for you. We're always there for you. I wrote this song after embracing a lot of survivors through my journeys coast to coast with Zero at the run walks. And this one's for all survivors to never feel alone. This one's called I Am Not Alone. I'm only 17, shouldn't be happening to me. Should be going to prom and football games, there's this disease, right, Trevor? I'm 35. I just got a raise, just closed on a 2-bedroom cake, got out on that lane. Feels like these walls keep closing in, there's no telling what's round the bend. Scared to death, to say the least, but I am not alone. I will stay strong, I won't have to do this all on my own. Love, care, this joy job, bills to pay. Can't sit around here crying all day. I'm 63, just got the news today. These golden years might be cut short and it's not okay. Feels like these walls keep closing in. There's no telling what's round the bend. Scared to death, to say the least. But I am not alone. I will stay strong. I won't have to do this all on my own. Love, care, this torch, this cross I bear. Fighting spirit still right here. I ain't ready to go home. In the dark of the night with the demons there, I got angels that still care. Right beside me till this battle's won. I am not alone. I will stay strong. I won't have to do this all on my own. Love, care, this torch, this cross I bear. Fighting spirit still right here. I ain't ready to go home. Y'all ready to sing with me? Sing it real loud at home. Come on. Here we go. 2, 3, 4. I'm not alone. I will stay strong. I won't have to do this all on my own. Love, care, this torch, this cross I bear. This fighting spirit still right here. I ain't ready to go home. 'Cause I am not alone. I am not alone. Charleston says you're not alone either. I am not alone. Zero survivors, we love you. You are not alone.
Hello again. I'm your host, Athena, and I want to take a minute to share my prostate cancer journey with you. Back in 2017, my dad was diagnosed with stage 4 prostate cancer. He was an amazing man. He was full of life. He always made sure everyone had what they needed. He took care of those in need, and he always put others first. This disease really changed everything for us. Before that, I had no idea that prostate cancer was going to be a disease that affected us all. We had to do something to stop other daughters from losing their dads. So in 2019, we created Team Hoboken Strong in memory of my father. On our first year, Team Hoboken Strong raised over $8,000, and we gathered a team of 20 people our first year to walk together in memory of my dad through New York City for the Zero Prostate Cancer Walk. We were all set to sign up, join the walk again in 2020 with even larger goals. And then COVID hit. As I'm sure you all know, it shook everyone's world. So I gathered up the team, I made the phone calls, and I let them know that Team Hoboken Strong was still gonna fight for prostate cancer because hope is at the core of what we believe. We got right to fundraising. To kick off the year, we partnered with Danny Margiata, a local New York City artist who used my dad's profile and his memory to help create a shirt. Easy to say, we squashed our goal in just under 3 weeks. The next way that we kicked off fundraising was through a cooking segment. Even though we all can't be together in person, there was nothing stopping us from being together virtually. So we had our first ever Cooking with Keith segment, and it was a great success. And we couldn't have 2020 without our own sort of walk. So we gathered in Lavalette, New Jersey with our close family and friends, and we walked our own 5K, starting with a stretch, walking the boards, and of course, ending with some pulled pork sandwiches. If 2020 taught us anything, it's that we have to be ready to pivot, we have to be resourceful, and we have to be creative. But the most important lesson that I took out of COVID is that the love and support of the community doesn't stop. Zero has worked tirelessly with so many other champions to help raise awareness and raise funds for all their various programs. But that's what happens when you're New York tough and Zero strong.
Hi, everyone. I'm Jamie Burse, CEO at Zero, and we're bringing you about an hour north of Palisades Parkway from New York City to Rockland County so we can talk about a new but yet familiar run walk to zero. The Andrew Zweig Ripple Run launched in 2018 at Rockland Lake State Park. Hundreds turned out that year to show their support for Andy, a beloved local football and hockey coach who fought prostate cancer valiantly for 8 years. Today, Zero is honored that this race is officially part of our national Run Walk series. Joining me today are two wonderful women, Nancy Diamond and Sue Spector. They're the powerhouses behind the Andrew Zweig Ripple Run. Nancy, this virtual run walk isn't exactly what we had in mind for this year, but we're still thrilled to have you both part of the Zero family. Now tell us about Andy and why you wanted to start this race in his memory.
Andy was just this epic man, larger than life, lived in Rockland County his whole life. So just had a lot of really deep connections in the county. And when Andy turned 50, he was diagnosed with prostate cancer. He lost his battle when he was 58. And when he passed, shortly after he passed, we asked his wife, Wendy, what we could do for her. And she said that she really wanted to have an event in his name, in his honor and in his memory, but also an event that would raise awareness. So when she made that request, Sue started doing some research. She found several organizations that work with prostate cancer. But Zero really stood out to her, and she was so excited when she spoke to me about it, because Zero was the only of the organizations that had that patient support component. So that was it for us. She reached out and connected with Betsy, and there was no turning back after that.
Sue, the Ripple Run began in 2018, but you connected with Zero before that, right?
We were still reeling from our loss, of Andrew. It was only a month prior, but we were eager and wanted to try to really take some action now. So Betsy London raised the idea to us about starting with Grow and Give. And of course, we didn't know what that was. And after her explaining it to us, we're like, great idea, because that was in November. So it was only 2 months later that we would be able to really start our journey. So Grow and Give, which was in November, became a great way for us to start sharing, with all of Andy's family and friends, our journey that we were going to begin to honor Andrew and, everything in his memory.
Ripple Run. Why? So tell us the reason why the name. What's the story behind that?
Andrew was a Deadhead. For those that don't know what a Deadhead is, he was a fan of the Grateful Dead. And Ripple was a song that was actually played at his funeral. And it was also a song that he loved. It was one of his favorite Dead songs. So, when we were creating, or Nancy's really the creative part of this, we came up with the Ripple Run, the Andrew Zweig Ripple Run.
Nancy, you know exactly how passionate this community is about Andrew because they've turned out to support you in the past. What's your message to everyone today?
I really want those people who've been supporting us to understand that their impact hasn't been just in dollars, that there's been change in our local community. And I guess I also want to just tell them, I want to tell everyone we still need you. Just because we're virtual doesn't mean we're not here. We're still working. Zero's still working. Zero just started a support group for caregivers, which is incredible. So we still need you.
Sue, Andy fought for a cure for himself and for his grandchildren. Can you share why it's so important to raise awareness and funds for prostate cancer?
From the start, we strongly felt, the lack of support for prostate patients in the Hudson Valley region. We felt also really strong about the need to bring awareness for people to take advantage of the early screening. And this was never about just raising money for Zero, even though money does everything. This has always been about how we could serve our community better, and make a real difference. And that was really what Andrew was about, making a difference. So we wanted to continue his legacy.
Well, he's making a magnificent difference. Sue and Nancy, thank you so much for joining me today. Even though the COVID-19 has tried to stop our 2020 Zero Run Walk series, I know that there's nothing at all that's going to stop the two of you.
Hello, everyone. My name's Andy Schmeltz, and I'm the Global President and General Manager of Pfizer Oncology. I hope this message finds you and your loved ones safe and healthy. 2020 has been an unsettling and tragic year for all of us. But this year reaffirmed my belief in the power of community. We are all in this together. And we will only get through this together. Because unfortunately, cancer doesn't stop. That's why I'm so thankful for our close partnership with Zero. Cancer isn't something that can be tackled by one organization, one company, or one person. It's a collective effort by us all. From working together on new initiatives to building awareness and fundraising, we partner together with one goal in mind: improving the lives of people living with prostate cancer. And ultimately, one day, finding a cure for this deadly disease. I'm constantly encouraged by the work happening at Zero to ensure that we eventually reach Generation Zero, or the first generation of men free from prostate cancer. Getting to Generation Zero will by no means be easy. Many barriers stand in our way. We must address head-on why Black men are almost 2 times more likely to be diagnosed with prostate cancer and over 2 times more likely to die from this disease than other men. These are disparities that cannot be ignored. I hope that in the future, we see 2020 as not only a challenging year, but a watershed moment in time. A year we can look back on with pride in the change we inspired and the strong partnerships we leveraged to help historically disadvantaged men living with prostate cancer. Please continue to stay safe and take care of yourselves and your loved ones.
Hi, everyone. I'm Jamie Burse, CEO at Zero, the End of Prostate Cancer. Andy, thank you for those kind words, and great beard, by the way. We're proud to stand alongside of you and everyone at Pfizer because we know that for each and every one of you, going to work every day is not just a job, it's a calling to make the world a better place, one patient and one family at a time. Black men are 2.5 times more likely to die from prostate cancer, but it doesn't have to be that way because we're in this fight together. And let's be absolutely clear, we cannot end prostate cancer without fully eliminating health disparities among Black men and their families. So let's get to work. Stay safe, stay well, and stay Zero strong. Check out our virtual exhibit hall to learn more about our partners. Our partners play a crucial role in the success of the Zero Prostate Cancer Run Walk celebration. Their commitment makes direct support for men and their families possible, both in your community and across the U.S.
2020 has been difficult for us all, including medical staff, who had to make adjustments so they could continue quality care without contracting COVID-19. In the center of it all, in New York City, is Mount Sinai. Dr. Jay Mottola shares with us what it was like early on in the pandemic.
I'm honored to be here today with Dr. Jay Mottola of Mount Sinai Hospital. Pleasure to have you joining us here this morning, Dr. Mottola.
So thanks very much for having me. I'm glad to be here today with you talking about Zero and prostate cancer.
So earlier this year, Dr. Mottola, New York City was the epicenter of the COVID-19 outbreaks. What was it like treating people at that time?
Before long, though, many of us were deployed. In our department of urology, we have a lot of people in our department, over 30 people. Right off the bat, 5 or 6 of us were deployed, and I was one of the first deployed physicians. But I was deployed, I was assigned as a frontline provider to a COVID unit, and I was really very scared, to be honest. I'm probably going to use the word petrified because I think that's really describes it. We didn't know what to expect. I didn't know what it was going to be like. We saw pictures, we heard terrible stories, we heard of people dying, and I wasn't sure what it was going to be like to be front lines. But we donned our PPE, and I was assigned to a team. And the scary thing was I was the most senior person on the team. I had myself and a person who graduated PA school about a week before. So the two of us went out and we were assigned to our group of patients. I think that first day we had about 8 or 10 patients, and we figured it out.
So, there's been a lot of people that obviously they couldn't get care. They couldn't get and say have their PSA test. Do you think there's going to be a spike in prostate cancer cases, after all this is over?
So I think that the answer is going to be that we're going to see that we have a certain plateau level. We have a certain level of number of cases that are diagnosed per month, per year, whatever you want to look at it. And when you look at it on a per month basis, I think, there's definitely going to be a very steep fall off in the number of new cases of diagnosed new cases over that 3 to 4 month period. I'd say that 3 month period of time, mid-March to mid-June. But I'm pretty confident now that the numbers are going to get back up. They're going to come back to where they were, and we're going to see a sudden surge. And that surge will probably just offset. It's not that the disease is going to prosper because people weren't tested. There will be, yes, a delay in diagnosis. But as we know, fortunately, so many cases that we see are early prostate cancers, and that delay, this 3 to 4 month delay, probably won't have a negative outcome on terms of patient outcome long term.
You were really instrumental, Dr. Mottola, in getting the New York City Run Walk started 2 years ago. Who would have ever thought that we were going to be here today, talking and having a virtual run walk? Being that you were so heavily involved with getting this started, how do you feel, this year, being that it's a virtual format?
So, what we're trying to do now with the virtual walk is to keep awareness, to just keep remembering that prostate cancer exists. Prostate cancer isn't going to go away because the COVID virus is here. It's still going to be here. We're going to still have to figure out what to do with patients, how to treat patients, how to provide care for those that can't afford care, how to get access to everyone that needs access to be treated. So it's good that we're doing this and keeping people, letting our patients know that we're still thinking about them, that we're still talking about this, that we're still planning ahead. And then hopefully next, fall this time, we won't have to worry about walking outside with a mask or running with a mask. And in New York City and all the other cities across the country can go ahead and have successful events next year.
Next year we'll come back and be able to celebrate all together.
Look forward to it.
We want to take a moment to thank our partners. First up, our host partners, the New York Section AUA, Hackensack Meridian Health, Montefiore, Weill Cornell Medicine, New York Presbyterian, Columbia Doctors, Mount Sinai, Northwell Health, and Rockland County Ripple Runners. Next up, thank you to our New York City and Rockland County local partners, Dendreon, Amgen, Progenics, Blue Earth Diagnostics, Janssen, Healthtronics, ABC Medical, and Bon Secours Urology. And shout outs to our national partners, Astellas, Pfizer Oncology, Bayer, Tolmar, FixedIncontinence.com, edcure.org, and SpaceOr Hydrogel. And thank you to APPV, our premier partner. Thanks to everyone for making today's virtual celebration possible.
Well, I think once you get that initial diagnosis, it's important to talk to somebody who's been through it. What I like to do is talk with them person to person and really get a feel for what they're going through and help them navigate the next steps of treatment. So I think it's important to really talk to someone who's been there, who's done it. People trust the Zero champions, And I think what it does is it creates a level of comfort that they can ask the tough questions and not feel ashamed about asking. And I think the mentors will be honest enough and also show a side of compassion because they've been in the shoes of this person. So I think that helps out tremendously.
From the very beginning of this pandemic, prostate cancer doctors, nurses, and healthcare providers pivoted because men's lives were at stake. Telemedicine, new safety protocols, and yes, a ton of masks were all put into place so that the prostate cancer patients could get the treatment that they needed. Thank you to all who braved the COVID-19 front lines and stayed zero strong through it all.
Yes, we totally hope that we're back together for next year. But I have to say, the selfless support that we're getting from all of you all over the country this year has been truly heartwarming. As a Zero champion myself, I want to thank you all for sharing this journey with us.
And it really has been a journey of COVID, prostate cancer, and finding hope during these very strange times. Please remember, we're all in this together. We are New York tough.
And Zero strong.
Thank you for joining us for the Zero Prostate Cancer Run Walk celebration. And a special thanks to our premier partner, APPV. To learn more about the Zero champions you've met today, Zero's programs, and how you can fundraise to zero out prostate cancer, head over to ZEROcancer.run. We hope to see you all healthy and in person for our 2021 Run Walk. And stay Zero strong.